Welcome to this episode of Eureka, and we have with us Dr. B N Gangadhar, the Director of NIMHANS, Bangalore. Thank you, sir, for joining us, and we will take a very short, brief look on him.
Giving an impetus to the treatment of mental disorders, Professor B N Gangadhar has been tirelessly working on mechanisms to address the complications of brain. Professor Gangadhar did his MBBS from Bangalore Medical College and MD Psychiatry from National Institute of Mental Health and Neurosciences. He has been associated with NIMHANS since 1982. Among the various noted awards conferred on him is the Sir CV Raman Award. Professor Gangadhar's research area comprises yoga, schizophrenia, public health, electroconvulsive therapy.
Thank you for being with us and sparing this time. I would like to start with the question that what kind of childhood you had? Where did you grow up?
I was born and brought up in Bangalore, and all my schooling happened here, and the Bangalore Medical College, which is one of the top 10 medical colleges in the country. I graduated from there, and then I entered NIMHANS for my postgraduate degree, and here I am as a faculty member.
Faculty member, and today you are heading this
Director
institution.
of the institute.
That's very nice. I mean, we are very glad. Let's look at your childhood a little bit more. Like, if I asked to ask you, who was your role model, or who inspired you, who motivated you to excel? Whom would you list?
Okay, my parents used to tell me a lot of stories about people who made a lot of mark in the
In the
society.
history.
Two people who inspired me a lot. One of them was Sir CV Raman,
Oh,
and then was Vishweshwaraya.
okay. Two Giants of Bangalore.
Yeah, my parents used to tell me the story, and in fact, I remember my dad taking me on my the cycle to show me where Sir CV Raman lived, and things such as that. So I think something to excel in academics, although I don't claim that I have, but that was some inspiration my father made it on me.
In your college days, in your school days, can you share some interesting incident which sort of even leaves memories?
No, it's something like this. Okay, why did I choose mental health as a profession? I didn't know that I was going to be a doctor nonetheless, but when people talked about ill health, physical health, I know people go to doctors, and they get us to be treated here and there.
So people can say that I have a headache, my
For
body
mental
temperature
health, I was
is high.
always intrigued as to what will happen. So then I realized when I was probably a 6th or 7th standard student, then there were psychiatrists who treat mental disorders, and they give medicines. I never thought that medicines would cure people those days.
Okay.
What organ they are treating? That was the question. So it went on, and then probably that curiosity made me to read more about mental health. And during MBBS days, over time, I thought I was getting fascinated to psychiatry. Although the medical college where I studied did not have a postgraduate training, but some of the psychiatrists who worked as the medical officers there, did show me some, did evince interest in my discussions with them.
Okay.
And so maybe that went on into cascading effects of becoming a...
You did your MD in the same institute, NIMHANS. What was the area of work that you investigated when you came to NIMHANS?
Yeah, that's, I think a good question. All of us give medicines to patients.
Yeah.
And then that time we were giving also, of course, even now today also we continue to use that, what we call electroconvulsive therapy. And when my seniors said you refer him to electroconvulsive therapy, I used to wonder often, would it be different than drugs?
Okay.
So that's how I went on to investigate the drugs and electroconvulsive therapy, and most of my career I went on to research on electroconvulsive therapy, its physiology, its biology, how it works, what are the diseases in which we can do, so that went on for almost my 30 years of research, little more than 150 publications only on electroconvulsive.
Interesting. For our audience, can you explain in simple words what is this theory, electroconvulsive therapy?
Electroconvulsive therapy is a treatment whereby an individual receives a very small electric stimulus on the head under an anesthetized state that produces physiological mechanisms in the body similar to what an epileptic attack that happens.
Okay.
But since he is anesthetized, you don't see an epileptic attack. That physiology comes in the brain, and that physiology brings a cascade of events which leads to patient getting better. And over these last 40 years I have been using electroconvulsive therapy. There has been a tremendous refinement in the procedure, not only the instrument, the way in which we anesthetize, the way in which we monitor, the way in which we assess the individual for getting better or not, where we have to stop ECT. So, a lot of things have happened, and I think today it has come to stay. I want you to remember that electroconvulsive therapy came before the medicines.
Medicines.
And people thought after the medicines it will die, but it did not. It is 75, more than almost 80 years today, and we continue to still use ECT. There are a lot of development that have happened.
Most likely you would have seen this therapy, electroconvulsive therapy, about 25 years ago, roughly, right? I mean, that's a kind of a career. I mean, you said that when you started, you were about
78.
Yeah, so about your MD, then it began. From then to now, what significant changes that has happened in this therapy?
Like I told you, now most people want to use the anesthesia, which earlier wasn't in the vogue. We have made electrotherapy, electroconvulsive therapy machines, the stimulus, so that we could even use much fraction of a stimulus what we were using earlier than what we have. We had very little means of ascertaining whether a person had the seizure-like physiology. Today we can have. We now can monitor any adverse event that can happen during the process more effectively with the instrumentation. And our clinical skills have gotten better, and we know the right person to be put to electroconvulsive therapy rather than indiscriminately, which could well have happened in the past before the drug therapies. Now we select people where these are the people
essential
who are
and yeah. We are having a very interesting conversation, but then we need to take a very small break, and don't go away. This exciting, informative conversation will continue. Welcome back to this episode of Eureka, and we have with us the director of NIMHANS, Bangalore, Professor B N Gangadhar. I want to ask you one question, which is perhaps the question that is in the mind of almost every common person, which is the moment you talk about mental health, the moment you talk about psychiatry, there is some kind of a phobia, some kind of a fear. Everybody wants to say that, no, I am not crazy. I don't want to go to a mental doctor. You know, I mean, that's a kind of fear and phobia that is there in the people's mind. Can you tell us something?
Yeah, there are two probably influential reasons why people. One, of course, there are no treatment for mental illness. That is the myth.
That's a myth.
Second thing is, the second myth is once a mentally ill is ever a mentally ill. Both I think are totally false. Now today we have treatments for mentally ill disorders, drugs and a host of other treatment approaches, psychological therapies, behavior therapies, traditional treatments, and like I mentioned, electroconvulsive therapy and a host of them. People can get better. I believe, and I have seen little more than 2/3 will become better and can remain well like you and me.
2/3.
2/3.
That is substantial.
So very substantial.
Yeah, please.
And in the other 1/3 also, it is not that all are written mad off.
Okay.
They can be perceived differently in the society as different, but even then they are functionally quite well. Like a person is limping, he is still functioning well.
Yeah.
A person who has some degree of blindness, he is still doing a lot of function.
Diabetics.
So there can be some disability, but then a lot of work can go on with them like you and me. Very small proportion would probably remain, quite disabled and not able to, and need help. This is number one, which is true with any physical illness. One. Second, it is not that once a mentally ill, ever a mentally ill. Like I said, 2/3 gone. They are like you and me. There is no question at all. You never say once a common cold, ever a common cold. Once a So
heart patient, ever a heart patient.
and even
Once
if
you have
some conditions which are ever, like for example hypertension, diabetes, you don't see them in that degree of stigma. So this is one part. Those two myths are probably fostering some stigma, number one. Number two, the way in which the mentally ill have been handled in the society. Sometimes inhuman, sometimes magico-religious treatments, and those things have been shown also in the media, various print and electronic media, little in an exaggerated way, which makes the, and also a prototype of a mentally ill fellow is screaming, is tied to the bed, and he is, so that picture is not there. If you can see around in the hospital of NIMHANS, that proportion is extremely small. You are right, and given that only the severest land here, even then you don't see all of them being
in that severest of.
They all get better and go. It is. I want the people to understand mental illness is like any other illness to our body. Mental hospital is like any other hospital. They can get treatment, they can go back well, and they can remain well forever.
Interesting point. Stigma is absolutely not needed with regard to mental health. Let's move to the medical sciences with regard to mental health. What do you think is the, let's say, the major leap in terms of mental health that we have achieved in, let's say, in the last about 3 decades or 4 decades?
Mental health, the progress has generally been seen as 3 milestones.
Yeah.
One of them long ago, when people thought mentally ill deserved the same human dignity and rights, they were unchaining the patients, and that was a long back, and that we continue. Even now we treat mentally ill people with great degree of dignity, and we give them respect. First level. Second level of second milestone happened about now about 70-80 years ago, when people introduced, there were no medicines, but like I said, electroconvulsive, there is a host of other treatments. In fact, 2 treatments also got Nobel Prize. We don't use them now, that's a different issue altogether. Then the third milestone was introduction of drugs. Now the drugs history is about 60 years, a little more than 60 years, and people have been using a lot of medicines. In the medicines also, there has been a lot of focus on how to make the medicines most effective, medicines be introduced most scientifically, medicines having least adverse effects.
Okay.
These are 3 issues.
3 issues.
This is one part of the treatment. The second part of the entire research or agenda in mental health is try to find out what causes mental illness. A lot of times, like if you have a diabetes, the blood sugar is more, or you have a test to make a confirmation, or you have a brain tumor, do a scan, you have a tumor. There are a lot of investigations. You have a heart attack, you put an ECG, you can confirm the whole thing. Is there any such confirmatory test in mental illness? And unfortunately, today we don't have a confirmatory test. But the research in the last 2-3 decades in particular, we have been able to identify many leads.
Okay, many leads for this confirmatory test.
That there is a brain disease which leads to the genesis, or it is associated at least, if not leading. There are a lot of brain mechanisms which can be detected as abnormal, and an illness in the individual can be associated. But I think we need to go a long way in making diagnostic utility of these tests. We don't have it.
We don't have it.
But in terms of treatment, even these the so-called investigations have given us some leads as to how we can use these investigations to help patients.
That's the hope of science always. I mean, like we want to do better, and then we want to give a better life to everyone who is born in this world.
When you say better life, it reminds me of this thing. The physical medicine people and the mentally psychiatrists, a lot of questions are asked. No, we treat them, we operate them, we give them more years to their life, and so on and so forth. That argument happens. So psychiatrists say we give more life to those years.
Those years, that's an interesting point. I think that's more important in a contemporary world, where our average life expectancy is increasing.
But
so
that
now
should have life.
Yeah, that's a question that I think we are all engaged in. How do you make the number of years that you have livable and worth living? That's a important point. I think you have a very important role to play. I mean, your science has a very important role to play.
No health without mental health.
No health without mental health. That's a good point. Let me just probe you a bit. You said that in the recent past, there are some leads we have by which we can see if there is something called brain disease, whether we can identify it. At least at this point of time, it's only associative. We cannot make it as causative. We cannot be very confirmative at this point of time because our knowledge is only growing. Can you
Maybe
elaborate
I'll
a
give you
bit on
some
this?
leads.
Yeah.
We have a very sensitive probes that are available. For example, the magnetic resonance imaging, by which we can actually measure parts of the brain also. For example, there is a part called as hippocampus, which is very sensitive, and we have been able to demonstrate that the hippocampus becomes smaller faster with our aging and developing some of the dementing illnesses.
Okay.
So like that, we have now been getting some leads in imaging. Functioning of the brain also we can actually look by giving some probes to the brain. The person is made to recognize emotions on the face, and some parts of our brain become active. Now in some patients, that recognition of emotions is not reflected by this physiological change in the brain. So we can diagnose some condition.
We are having a very interesting discussion, and I think we should continue this conversation. Our audience would be very interested in it, but then we need to take a very small break. We'll come back. Don't go away. A small break. Welcome back to this episode of Eureka. We are with us Dr. B N Gangadhar. Before the break, we were discussing about some of the
brain
new
probes.
techniques, new brain probes. If you look at the history of, let's say, psychiatry or brain studies, in olden days, one reads that one had to wait for a mentally ill patient to die so that you can operate their brain and see which part of the brain is affected and then try to understand. Today we have some more. Can you explain us some of these new techniques?
Like I told you, we can actually measure some of the parts of the brain. The grey matter and white matter we can measure.
So you can measure
we can also
parts.
measure the connectivity between the different parts of the brain.
Okay.
For example, in patients of different mental disorders, connectivity has gotten changed. And we can actually measure the chemistry of the brain without having to study any part of the brain. The magnetic resonance spectroscopy we can help us.
Oh.
We can also measure various brain receptors where the messengers of the brain act, where our medicines act. We use what is called as the positron emission tomography. These are possible, and then of course this is about very sophisticated equipment, very expensive. Even without that, we have many other simpler electrophysiological medicine methods wherein we can study the brain physiology. Not only brain physiology, the brain and its action on the rest of the part of the body, which has gotten changed in illness. For example, heart rate. The heart rate has a variability which is influenced by whether I am relaxed or not relaxed. As simple thing as that. This also is now beginning to be investigated. So it looks like, and of course, using the blood, there are a host of things that have become possible. Whether a mechanism to repair your brain is happening time to time, that we can measure. So there are immense potential. I want you to take home this message that unlike earlier, medicine has opened its doors to all scientific specialities in the world. Whether you call the engineers, whether you call mathematicians, whether you call chemists, you call physicists. So a host of other specialists now have to operate in terms of making the medical specialty brighter.
In fact, continuing your point, I mean, actually, some time back I visited the National Brain Research Institute, and there are some philosophers who are part of the team. So it's a multidisciplinary.
No, even in our own institute, there is a program called as MPhil in neurosciences. Okay. There are people who are engineers, who are computer scientists, who have taken up this course to study the intelligence as part of the brain, and then various other.
See, one interesting thing that is happening in the last about 2-3 decades all over the world is the aging of the population. Like in India, the average age was something like about 39, and today we are about 63, and of course it's going to go up. So when you are going to have more and more aged population in the total population, some of the things like, for example, dementia or Alzheimer?
I'll come to this. This is a very important question. Aging is a natural phenomenon.
Yeah.
All of us age, but some age prematurely.
Okay.
And both these conditions, normal aging has its own challenges. Premature aging brings in some different
challenges.
conditions. Now, I'll give you one example of premature aging. For a condition called as schizophrenia in psychiatric disorder. There are groups of scientists who believe that it is a part of premature aging.
Oh.
Not only aging, premature aging of the brain, premature aging of the self. The individual becomes more withdrawn, like elderly or old people have gotten away from the rest of the society, and they develop diabetes much like
earlier.
a little older people develop, and then their memory functions are poorer like the aged people. So they are linking some premature aging to some of the psychiatric disorders. Of course, aging is also a serious challenge. People have addressed the aging research, how to facilitate brain to repair itself and remain eternally young.
Yeah.
Of course, we have not been always successful. There are some leads that have been possible. I'll give you one or two of them. I'm not sure whether they have the best answers to the whole thing. Our cognitive faculty drop as we get older. Now, there are methods wherein we can stimulate that cognitive process by using electricity.
Okay.
What we call as transcranial direct current stimulation. This is a very, very simpler procedure. OPD, one can receive this treatment and go back. And we have methods in which we can use the MRI facility, functional magnetic resonance imaging facility, and see which part of the brain needs that stimulatory exercise.
Okay.
I'll give you another example. People have been talking about yoga today. Yoga has been one of the important tools people have investigated about its role in reversing aging, at least stopping aging. There are research that has gone on in our own institute. We have done some institute. I'm sure you passed by the yoga
Center. And then, yeah.
We have been putting yoga to treatment for various psychiatric disorders, and an interesting exercise was done whether yoga can stimulate this brain repair mechanisms. Now, there is a chemical called as the brain derived neurotropic factor, and its level increases if a person has done yoga for 3 months or longer. And this increase of the levels of the brain derived neurotropic factor seem to protect this individual from depression. His depression scores start coming down. Likewise, we also have some evidence that in elderly individuals, with the time passing, like I mentioned, this hippocampus actually should shrink.
Shrink, okay.
We did yoga, we helped about some patients to practice yoga. I wouldn't call them patients, they were healthy subjects to practice yoga. And 6 months later, this group of 8 subjects or 7 subjects, the hippocampus actually had gotten bigger.
Okay.
It is a statistical observation. I am not saying that it is the foolproof demonstration of
some
benefit,
lead for further
but
research.
then there is some lead that yoga applications could have a protective effect. Of course, we need to do a lot more study in this area, but I think we are making some beginning.
See, given the kind of changes that is happening in India, one is that the population age is increasing, and so which means that people are going to live longer. Large number of people are going to live longer, and the population size is also increasing. And with the increased awareness, more people are also going to seek mental health. So, what do we need to do in India to ensure that everybody gets mental health facilities?
Now, first there are two different components into that. Older people, what should we do? Now, getting aged is not always to be seen as a challenge.
Okay.
It is also an opportunity.
Opportunity.
Because there are more experienced people. In fact, if you see some years ago in the American Journal of Psychiatry, one of the Indian authors wrote a very big article, Aging and Wisdom.
Aging and wisdom.
Wisdom. So it looks like more aged population, there are more wise people. And you probably have to keep in mind that this has also given you an opportunity to utilize people who have more experience, the wiser people available, more number of them. And there could well be more productively exploited. Of course, age, physical illness has its own complications and challenges that we need to address. This is the second part. The question that you asked me was, how do you reach mental health services to everyone?
Yeah.
Now, this is a very burning question and people have been talking about it. Always they say whenever there is a mental illness, you look up to a psychiatrist. Now, I probably differ here. When a child becomes ill, you don't necessarily have to go to a pediatrician, you go to your general doctor. When there is a sprain in your leg, you don't always go to an orthopedician, you go to your GP. When there is a loose motion, you don't go to a gastroenterologist, you go to your, when there is a common cold, you don't go to an ENT doctor, you go to, when there is an eye, there is some infection, you don't go to an ophthalmologist, you go to a GP. My own guess is, like that, many mental disorders can be addressed by the GPs, primary care doctors.
But then the primary care doctors have to be primed for it.
Have to be enthused that this can be treated, and today we have the technology to make this reachable. And medical schools also have to give a little more emphasis on exposing the undergraduates to a little more of mental illness, and that is possible. So, one question is, if all the primary care doctors think that mental health is health, no health without mental health, and they are also willing to address this problem to an extent, I think we have crossed a great hurdle.
Okay.
Psychiatrists alone facing this challenge is going to be a mammoth task, and I don't think we're going to reach that in the near future.
Near future.
So, but the government has made what is called as a district mental health program, which they have already covered almost half the numbers of districts. They're going to expand it to all the districts, whereby the mental health services will be reached to the public through the primary care doctors. So, psychiatrists will be instrumental in facilitating this.
Interesting. Two messages from this conversation I think we all should take away. Number one, there is no health without mental health. Second, throw away two myths most of us are engaged in. One, mental illness can be cured. Number two, if you are a mental patient, it doesn't mean that lifelong you are going to remain as a mental patient. This message is the key message from this conversation, and we thank you for being with us, and it was a very exciting and interesting conversation. We'll continue this program of Eureka in the next week with another interesting personality. Keep watching Eureka.